There's a difference between what the state license allows you to do versus what tends to culturally happen in healthcare, if that makes sense. So one thing that people tend to think is, occupational therapists work on the upper body and the arms, and physical therapists work on the legs and all that stuff. That's more of a cultural difference out of necessity in some facilities, such as hospitals and skilled nursing and things like that, almost out of necessity, but it's not like a practice act difference where the physical therapist does not work on the arms. Because if you go to outpatient physical therapy, we work on the arms and things all the time. So there's a cultural difference, but there's also then a legal difference. Simply, the physical therapist will help you get to where you need to go, such as the restroom, a shower, or whatever it may be, and then to be able to physically do the things that you need to do, let's say like your balance or strength or whatever it might be. And this is a full spectrum. The occupational therapist will, in the spectrum of things, teach you basically what to do once you get to that location. Let's say you get to the toilet or you get to the shower. What do you do once you're there as far as the actual things in your life that you need to do? And understand the confusion comes because there's the full spectrum in between, where the occupational therapists, of course, are doing like 75% of the things that the physical therapists are doing, and vice versa. And so I think that's also where the confusion is.
Yeah, I mean, I think even that to a certain extent is sort of, we almost have that distinction of like the PT gets you there and then the OT does the thing with you when you get there, almost as another like almost kind of artificial way of just making sure there's not a perceived overlap of services. My job as an occupational therapist is to think about your occupation. And by that, I don't mean the job that you have.
Yeah.
It's defined really broadly. It's literally anything that you need to do, have to do, or want to do. So for me, that goes anywhere from helping people to sleep, to use the toilet, to do rehabilitation for workers' injuries. It's a really broad
Full
scope.
spectrum.
It's a huge scope of practice. And so some of the tools that I have in my toolkit versus what a physical therapist might have in their toolkit are a little bit different. In terms of occupational therapists tend to do a lot more environmental modifications. We also are focused on the activity itself, and how that can be modified, as well as the physical characteristics of the person. It is honestly, it could be like, we could do a semester long course probably on the difference, but a lot of it is, there's not one is not more valuable than the other. And in fact, I think that we work best together as a team.
Yes.
But it's really in some ways just a difference in the perspectives of the way that we're looking at a situation and some of the tools that we have in our toolkit to kind of manage that.
And